saw earlier, so I think we turned it down, but now.
I'm going to call this meeting to order. Welcome, everyone. It's our clerk. Call the roll, please.
Member Sergeant? Here. Member Andrew? Member Paul Smith?
Here.
Member Cornell?
Here.
Member Parks? Member Ferrero?
Here.
Member Peterson?
Here.
Member Snyder?
Here.
Member Twombly?
Here.
And Chair Wiley?
Here. Right, any member of the public, I'm glad to see lots of faces today. If any member of the public wants to be heard, you can come forward to the podium at the appropriate time, introduce yourselves to the board. Members of the public recognized by the chair will have 3 minutes to speak on a single subject matter or to address the current motion on the floor. The general comments are open, and then after that, it's to speak to the motion that is on the floor, and the clerk will function as the official timekeeper. Before I ask for agenda approval, we do have a couple of changes that I'm going to make. I would like, in lieu of my report, to have Commissioner Cornell give us a little bit of an update on the appointment nominee process. And then we are going to move the 2 items on the agenda under old business, the resolution 2022-17 and the number 12, the program update. We're going to move those right behind the executive director's report because we have supposed to may not be able to be here late, and we want to make sure to have input from everyone. So with those 2 changes, or any other proposed changes, I would love a motion to approve the agenda. Approve the agenda with the said modifications. A motion is second. Any discussion? Thanks.
Madam Chair, I have a question about the item number 7, but I think it can probably be covered when we're talking about the summer program.
Okay. All right. We'll bring that up then. Is that where you want to pull it out?
No.
Okay. All right. We have a motion and a second. Do you have any public comment on the agenda? So none. Everyone in favor, signify by saying aye. Aye. And any opposed? I did not ask to have the consent agenda included, but I'm assuming since we just talked about it, I have all the consent agenda everyone. So you're all there for both. Okay. Thank you. All right. General public comment. Anyone from the general public wishing to be heard, please come forward and introduce yourself.
Hello, hi, I'm Julie Mowry. I'm the director for the Healthy Start Coalition. I just wanted to take a couple of minutes to update you all on what's happening with a couple of our programs. With newborn, as you know, we presented at a couple meetings ago about our progress from last year. I just want to remind you that we did more than 300 assessments more this last year than we did the prior year. Also, our nurses are doing child passenger safety checks, and we're doing more of the community infant CPR and infant safety courses. We're also realizing that our assessments are lasting a lot longer, given a lot of the mental health concerns and needs of the clients that we're serving. So I just wanted to put that out there in hopes that you all consider increasing our appropriations because we need to hire an additional nurse. Our nurses are maxed out. So I just wanted to bring that to your attention. In hopes that we can have further conversation, or you can give us some guidance on how we move forward with that ask. Also, I wanted to share about our Nurse Family Partnership Program. So our Nurse Family Partnership Program provides a nurse to substance using pregnant women and their substance exposed newborns up to the age of 2. This is captive funded through DCF. Our funding is going away at the end of this year, possibly through June 30, if they can find a way to get additional funding. That means about 44 pregnant substance using women or substance exposed newborns in Alachua County will no longer have services. So again, I hope that that is something that you all may take into consideration, or if you'd like me to share more information about, I would be happy to share. Any questions?
Marcia, would it be appropriate for them to participate? You're doing a listening project.
They have.
Okay. So did y'all ask? So we know about it other than right now. because that's how we move, in the future budget, is a little late for this budget. But in the future, we can be mindful of that, of what's out there that we need to do.
Okay, so in the future, that's going to be the process, because we just weren't sure how to share that information.
It's a little different.
Yeah.
Trying to get input from everybody. The best thing to do, I would think would be, if it looks like there's a shortcoming, before we really get into the meat of the budget process, would be to have a conversation with Mark. If you recognize, because by September, our budget is pretty much done. And so next time would be the listening budget, and which we put, I think that's going to be in March. March, April is when we're formulating the budget. That's the best time to get them on the process. Hopefully that helps.
Hi, could you elaborate a little bit more on the why you said it's cutting your funding, since this is kind of critical? Did they tell you guys that?
It is, the appropriations are ending. It was a limited thing, so they're hoping that they will find additional funding to be able to support it at least through June, so that our families don't get services cut off right over the holidays, and that our nurses no longer have positions as of December 31st. So they're doing a no-cost extension through June 30 in hopes that sometime this month, the legislators will determine whether or not they'll continue the funding through June 30. But after June 30, even if they get to that point, it doesn't promise me after that point. So the funding goes, currently it's capped and it goes through Partnership for Strong Families to us, and it will, like I said, probably end December 31st, maybe June 30th.
You want to also talk to the managing entity for substance abuse and mental health.
So we have talked to LSF. We're going to continue pursuing that option. We're pursuing every avenue that we can possibly. Alachua is the one area that Alachua and Marion, to be honest, are my two areas of concern. Because that's where the most of our clients are. So we're going to have to figure out how to get funding for those two counties.
LSF typically with that starting February, March,
Yeah.
start looking at lapsing dollars. And certainly substance abuse is going to be something that they would prioritize. So I would very definitely stay in touch with them, because they will appropriate lapsing dollars.
Thank you.
Any other public comment?
I am Shelley Vendors, also works on Star North Central Florida. We just wanted to announce that we are launching a regional FEMA program, which is a fetal infant mortality review. For those of you who don't know, it's a national evidence-based model to reduce infant and fetal mortality, as well as reduce racial disparities by making systems changes to improve services and resources for pregnant women and families. We're passing out flyers on the process overview, as well as information about the two different community groups that we will be recruiting for. Everybody in this room is perfect for and has a role in the process that's to come. This has the potential to really drive a lot of what we do in the future. We are very excited about this opportunity. This is to provide us data and information on what is specifically happening in our communities and what is leading to our fetal and infant mortality rates as they are. In your handouts, I also included information on our local data for Alachua County, in case you were interested in what the local data looks like. The current methodology that handed down from the Department of Health is allowing us only to review 3 Alachua County deaths per year. So if it is of interest to this board to review all of the deaths, which is approximately 52 fetal and infant deaths, then that is an opportunity we can discuss at another meeting. But we are really truly asking you for you to volunteer to participate in this process. And there is a way for you to contact us in the handouts I gave you, and more information about each of the different teams involved in the process. Does anybody have any questions for me about FEMA?
Any questions?
This isn't a question, it's just a comment to reinforce what you have just said. And when we started looking at the original data that we wanted to follow to see if we were achieving our goals with the trust, one of the things we chose was low birth weight, because we knew that that was even more common than infant mortality. And I'm dismayed to see that even if we look at infant mortality, which is a more crude measure of well-being of mothers and babies in our community, look how poorly our death rate performs compared to the state of Florida. And you've got to ask yourself, a community with as many smart people and as many health facilities as we have, why should we have such a high fetal infant mortality rate? We have to ask ourselves, what is the system's issue? And stop blaming it on the moms and saying, well, it's her fault because she didn't get early prenatal care. There's way more to it than that. So that's my soapbox for the day.
I appreciate that, and I wanted to mention that one critical part of the FEMA process is the parental interview. So everything is based on the getting the input of the family to find what the social determinants of health were and get to the underlying root of the issue rather than blaming, casting blame, oh, this family did this or didn't do this or didn't access services here. Also, I wanted to point out also the racial disparities in our infant fetal deaths in Alachua County. They're very concerning to say the least. So I appreciate you providing that input.
Where it's listed about what thing is not.
Yes.
I feel on the first people that it's not about design, not about seeing any pictures and all this. Can you just elaborate on the third bullet for me?
Let me get to which one it is.
Thank you.
The purpose of that whole section was, I think that some people have experience with the CATER process, the Child Abuse Death Review. Those are currently already in existence in all of our counties. Those focus specifically only on deaths that were called into the child abuse hotline. Those are focused on deaths of 0 to 17, and it's only child abuse related deaths. I wanted to point out the difference that this is related to any type of cause of death because anything can be learned from any death. So it's not specifically about the child abuse deaths. And so there's going to be effort at the Department of Health level to make sure that we're not reviewing the same cases that CATER are reviewing, and try to keep any redundancy from happening. I'm sorry, did that answer the question? Okay, thank you.
So are these children who are Alachua County residents, or are these some of these children brought to UFL for intervention and that are dying here?
Our region is 12 counties. Alachua is one of those counties. It's based on the child's residence at the time of their death is what county they're labeled in.
So it wouldn't like the different child was like from Suwannee County to Alachua County, that would be Suwannee County.
Correct, yes.
Why only 3?
It just seems if you've got 12 counties and there's 50 some deaths and you're only be allowed to review 3.
Because of the priorities in trying to make sure that we are truly getting to the understanding what's happening in our rural communities, they laid heavy emphasis on our high-risk rural communities. So we're being required to review so many records from those counties, and with 12 counties, it is just eats a lot of the cases being required. So there was some discussion at one point that the Children's Trust might be interested in having all of the cases reviewed for fetal and infant deaths, and that would require the hiring of another nurse, but that is something we can have a further conversation about. And again, as Dr. Hart mentioned, this would really provide the data for a lot of what we do moving forward.
Other questions?
Is this where the like the data where after you come up with recommendations for like prevention efforts and promote that?
Yes, ma'am. The process, there's a 2-part process. So there's a case review team, which is made up of a lot of the people in this room where we review and analyze the data, including the parental interview, and develop recommendations. The part that's missing from CATER that the FEMA process has is the second part, which is a community action group, which has the people with the political and fiscal will to actually make these large systemic changes to the community and have the ongoing CQI to make sure that those implementations stick.
Any other questions? Thank you very much. Any other public comment?
Good afternoon. My name is Sylvia Garcia, and I'm also part of the Healthy Start Coalition. And I'm here to present to you a project that we're trying to implement in our community, and it's the community food program. You mentioned that one of the goals for the children's to decrease low birth weight. And having doulas is an evidence-based strategy where we, it's shown that it decreases low birth weight, preterm births, need to transfer C-section rates, and breastfeeding initiation and continuation rates. It also, it improves a lot of the outcomes on the during pregnancy and after baby born. Why a growth community doula model? There are many models out there. I am myself a doula, and there is a big gap for women to become doulas and for women to get doula services. So there's a lot of disparity, and the community doula, what it wants to do is to train a diverse group of doulas from the community so that they can get trained and certified. And that's what the program does. It has been implemented in Indian River, by Indian River Healthy Start in their area, and it's supported by the Cleveland Clinic. It has proven short and long-term outcomes. So one of the strengths is that it recruits, trains, and connects women within the same community. So if their peers supporting them through birth, and also we started the process by doing an assessment in our area, and it has shown that women are interested in having doula services. Right now, it's easier for the self-paid women to get doula services. Everybody else who has Medicaid has doula services in their approved services, but for doulas it's really hard to build Medicaid. So what this program statewide through Healthy Start is trying to do is to close that gap and make doulas capable of building Medicaid through us, and so that more women can access doula services. So there is a curriculum that's already developed. It's proven. It works, and it's working in their community, and that's why we want to bring it to our community. Right now, we are in the process of getting $10,000 to $50,000 from Human and Sunshine to get the program started, but we would need about $75,000 to get the doula coordinator to work and start a program and start recruiting doulas in the communities that want to participate in the program. That's in the materials that you get right after the brain page. There's the doula information. There's some data that can you can read and see what doula services offer women and how it impacts pregnancy outcomes in the house. And there is little video that you can access, and you can see from the children's clinic how it works, it has worked, and then Shelley's information if you have any
questions. I did. I was, thank you for this info. When you started to mention the doula, I was going to ask me if we have something with our system grant that's something with doula. Is that training, or does it complement this, or?
It complements it in that we are doing training. It's a different training than the program that Healthy Start will be doing, but it's training, and then of course creating a support of alliance. The difference between ours is that they also have the Medicaid piece, where if the doulas are wanting to be a Healthy Start provider, and she'll have to correct me how that piece is from, where they can then also the Medicaid piece she just talked about. So they would act as that person to help with that billing part of it. And we're not doing that. For sure, does not pay for that direct service care.
Thanks.
Have y'all spoken to the Senator about trying to get the legislation changed for filling Medicaid? Because if it's something that requires the legislative action, he's very, very interested in helping children.
It's already eligible, right?
It's already, yes, it's hard, we can feel the problem, it's very hard, so individual doulas find that process very difficult, and they're not successful at it. So it is a big gap in what doulas can do and what women.
Unless they're a cash issue that has to be possibly to bill Medicaid, billing Medicaid as an individual solo, everything is very impossible to cost.
And the way Healthy Start has it right now, statewide, we will be able to start providing services January 1st. So because we have the curriculum, we are ready for the training, we have the trainers, we have the structure to start providing services January 1st. So that will be something.
I think one thing that might be helpful is for us to be able, not today, but at some point to hear what the interface is between the training that the trust is sponsoring and the curriculum that's being implemented through your program. That was really helpful information to know. And sort of being able to see whether or not the training that's being provided through your particular program, how well it aligns with the training program that the trust is offering. Seems to me to be something really important for us to think about, right? Any other questions? Dr.
I don't know a ton about doulas. I'm favorably disposed though, and I just wondered how many clients does one doula have?
In the program, the way it's designed, a doula can take about 4 to 5 births a month. Because you don't want to over, it's you know, it depends on when the mother is going to the birth.
So you mean 4 due dates per month?
Yeah.
Okay, so they could have quite a few clients if they are entering into a relationship early on in the pregnancy and the pregnancy lasts 9 to 10 months, right? Okay. So the reason I'm asking this is because whenever anybody comes and asks us for money, we are very interested to know how many families or children will be impacted by these dollars spent. And I hope you listen very carefully to what Dr. Snyder said, because reading between the lines, we love the notion of helping mothers and babies, but we're not totally wild about having 2 towers of doula-ness in Alachua County. There needs to be 1. So you guys need to figure out how this can be a systemic change and not 2 little columns of effort. So I'm going to leave it to you guys to figure out.
Other. Anything else?
Right?
Yes.
No, it's excellent.
I think the other thing that will be really helpful for you all to help us moving forward, all of us following up on what Dr. Hurd was saying is, you know, we hear a lot about proven programs, and I in no way want to be pejorative about what you all are saying, but proven programs are proven for certain groups in certain geographic areas under certain conditions, right? And so there's this tension between how we take a program that's imported into Alachua County from anywhere in our state or even our country, and think about what are the adaptations that need to be made, what are the tolerable adaptations that can be made that still makes it an evidence-informed program, but that it fits better in our context. And we can't figure that out without information and input from all of you who are out there every day doing the really, really hard and difficult work. But we partner with people, right, to figure out how to fix those issues. And that's really what results in meaningful change and integration, as Dr. Burgess.
So that is great. That's why we started with the assessment, and we have a community assessment that keeps on going. And that will be happy to share.
But as you all go through that curriculum, it's like what's working and what's not working and wrong, right? Because you'll know, right? Just because some scientist said it's proven, right? Trust me. Yeah, she's one of those guys.
Somebody saying that some people have heard that distinguishes evidence-based practice from eminence-based practice, right? You know what eminence is? Repeating the same mistakes with increasing confidence over
Yes, indeed.
And scientists have to think about that, making that distinction. So you know more than we do about what's going to work, but we know about the science piece and how it needs to be adapted or can be, right? So do the developers of the proven program.
Thanks.
Sorry, didn't, I don't, yeah, so I'm gonna do it all over.
I think that's absolutely important. Thank you.
Thank you. Any other public comment? I do want us to remind folks that our funding strategy is, as Mr. Pinkerson pointed out, is going to be largely driven by our listening session and then our strategic planning. And all of this is really important information. We want to make sure that we work with staff so that they have that as we evolve our recommendations and set our priorities. It's really important that we understand that this is a process and that it's a process that has tons of priorities to juggle and to try and balance for a large but limited amount of money. So with that, I'm going to move. I do not have a report today, but I did, as I mentioned, as we approve the agenda, want to ask Commissioner Cornell to give us an update on the process for sending nominees up to the governor's office for 3 vacancies.
So we have a meeting at the county commission tomorrow morning where we will select from the group of applicants, names who will then submit to the governor for them to sit on his desk while we then wait to appoint. What we have done in the past is for every one governor appointee, we have nominated 3 people. So there are 12 applicants. We have 2 spots. Dr. Schneider's spot and Dr. Labarge's spot. I think we've already submitted the.
Okay.
You did, but she was worried. So I think Sharon did was the year before we did. There's been one since then.
So even when there's an incumbent who wants to remain in the seat, you still send 3, is that correct or not?
Okay,
Well, I believe, and Ashley will correct me if I'm wrong, I don't know if Bob's on Zoom or not, but so Lee and Karen were in the pipeline because they expired, I guess, in 21. However, Dr. Karen Cole Smith has informed us she's resigned from the board. So that's why you're now talking about the 3 right now.
Right, so for Lee, we only sent up Lee,
No, there were 2 names that went with Lee, but that's.
but they said they wanted to retain you.
What they said was and I don't know what they said to the government, but they said that they would encourage me to reappoint.
Well, they did send up 3 weeks, so.
But have you been reappointed?
No,
Haven't heard.
They haven't reappointed Karen, right, she was a rep one, and it expired, she expired in 21, Lee expired in 22, I expired, Pat and I expired this year in January. Yeah, so we shouldn't be surprised. We shouldn't be surprised. So you do have 12 applicants and you're gonna have to send out 9 of those, is that correct?
Perhaps, yeah, I need to now have a conversation for the minute. So the 12 names are Mary Chance, Rachel Coleman, Anthony DeLisi, Daniel Fisher, Adam Joy, Leanne Lawrence, Stephanie Norman, Elizabeth Patton, Stephen Pennypacker, Shannon Frito, Patrick Schneider, and April Tisch. So, yeah, so that's, yeah. And I'll have a conversation with the about maybe and that check the status for what 3 names
So Commissioner Cornell, I'm sorry to jump in. Tomorrow at the commission meeting, are you going to allow the applicants, like usually there's 3 minutes or something?
Yeah, our typical process is we say, okay, we're gonna make some appointments now, and then we give anyone that's applied an opportunity to speak and let us know why they would like to serve on that particular board.
Okay, and can you tell us when that's going to happen tomorrow?
It's first thing, so we start at 11:30, and this is one of the appointments is one of the first things on the agenda, so
I would say between 11:30 and 12, we'll be having this discussion.
Thank you. Any other questions? for Ken? Thanks, Ken. Marcia, Executive Director's report.
All right, I will be brief. We had a busy month. Since I started on the first, it has been meetings, but I have enjoyed every single one. Since we met, I went over and spoke with the folks at the Education Foundation, met with Representative Yvonne Hayes Henson, had a great meeting with the Child Advocacy Center, and also spent some time with the folks over in Newberry. Everyone, again, has a heart for children, wants to see services and programs for children. Our folks from our rural communities want us to not forget about them as we continue this process, particularly our listening project. And so just really having great opportunities to meet with people, to talk about what we're doing, to get their input and insights, and then to commit to them that, especially those in the rural communities, that they will not be forgotten. We also had our BLI, Early Learning Owner and Director Kickoff Dinner. It was at the same time as my visit to Newberry, so I was not personally in attendance, but from what I hear, it was well attended. We had 25 participants for the second level. Everybody is really excited about it, and I want to thank Mia and Christy for their hard work with that program. And then lastly, 5 staff, in addition to me, so I guess, 5 of us, 4 staff and me. We attended the Florida Alliance of Children's Councils and Trusts Conference. It was my first opportunity to meet people who do what we do in other places. They were very welcoming. It was information overload for your new executive director. But I now have a group of people who are willing to answer questions, support me in my new role, and then of course it was just great. This was the first time that all of them had been back together since 2019. So you can imagine they've had our agenda with information sharing and opportunities for all of us to present. And so Christy presented on Teens Work Alachua and our success with the program. I think some folks want to copy what we've done here in Alachua County. So we have people wanting to know what we're doing, as opposed to us, asking them what they're doing. And then I did forget one, I think, really important piece. So when I was in Newberry, the folks from the city shared with me that they had hired one of the students from Teens Work Alachua. So that was a good news report that I received. But that's my report.
I will say that when Marcia told me she was feeling overwhelmed, I said, that's about where you should be feeling. It was not information overload, in your something wrong. So I think also she certainly has hit the ground running, and it's been busy going all over the place to get input. So I think thank you, Marcia. I appreciate that very much. Okay, so that means we're now into the 2 items that we moved up in the agenda, and the first of those is the resolution on the emergency closure policy.
So at I believe it was your September meeting, when the first storm rolled through Ian, you asked staff to come back with a policy for emergency closing. We found that there was a weather-related closing policy. And so what we did was really just amended that and put it into an emergency closure policy for your approval. Are there any questions about the?
Marcia, we spoke when you spoke earlier on I'll look at paragraph number 7 and the new portion. It starts out, if an employee is not scheduled to work on the day of a nurse is supposed to be with paid holiday. Or the employee is out on paid sick, vacation, or personal leave, the employee will be charged with such leave. The only problem I have with that is paid holiday, that's okay, but if everybody has been off because it's an emergency thing, I don't think that we should hold their paid sick, vacation, or personal leave against it. I think that should be a pass, from a fairness standpoint, but the paid holidays, that's fine.
And what Lee has mentioned is the way the state does our policy with that, that if you're out on your annual leave and a hurricane comes through, it switches to AP legal administrative, everybody else is going to one. Lee, I had that same thing underlined, but the sick one, I disagree with that one. I think if you're on PTO or vacation, whatever we call it here, that, but if you're out sick and there's a storm, I don't think we switch it to head, because if you're out sick for the storm. So I think I agree with the PTO, the vacation one, but I think the sick one, I think we should leave that together.
The only problem, the only thing in this, this came up last time is, if something bad happens in the family, we have to take a lot of sick leave. That's a day that they wouldn't have otherwise. So, I'm not conforming on that. If vacation versus leave is much more good, that's hard.
You sort it all that stuff out.
Yeah.
I think it's
one for one.
one to do whatever,
I'm more than fine with what you said, and actually, had I read this a little bit closer, I probably would have made that change myself, please. So
is the change he is proposing simply to say if whatever is not counted against anybody's leave, then right, they have to be on leave on an emergency. Is that
With the exception of paid holiday.
with the exception of paid holiday? Right, that's a line of the state. So we do sick leave, if you're out on like extended sick leave and a hurricane comes through and it's a lot, you don't charge sick leave for that. So, right.
Okay, so
Kind of like we do, yeah,
Madam Chair, I would
Yes.
agree that adoption changes to the handbook for the exposure really changes that.
Motion, we have a second? A motion is second. Any other board discussion? Any public comment on the motion? Seeing none, all in favor, signify by saying aye. Any opposed? Okay, passes, thank you. And now Christie, permanent. Okay, I'm going to share my screen. I'll shoot some the summer program
screen. There we go. All right. So the purpose of this first presentation is to provide an update for the summer programming for fiscal year 23. There is, I don't know if there's any recommendation in the board folder for this, but to provide an update. I do want to start with speaking a little bit about the what we've done. How did we get here? And so just as a reminder, we did have the summer camp enrichment RFP. This was well over a year ago, where we released the funding opportunity through the community to be able to apply for these dollars and explain to us how they would be working with children, what type of summer camps as well as enrichment would they be able to offer in the community, whether it was a new opportunity or whether it is an already funded or already camp that has been established that they were interested in receiving funding for. The trust, when the RFP was released, there were $1.1 million that we had, the board had agreed through the RFP, and then actually awarded $2 million to include, I think about 24, 25 summer camps, and then about an additional 5 or 6 enrichment providers. That RFP did include a 3-year renewal, and we are, this summer will be the 2nd year, and then summer 24 will be a 3rd year. Through that RFP, we did agree to terms such as incentives, and there is a slide that goes into detail in a few minutes that I'll be able to show you that includes incentives. We did also agree to those children be able, in order for a provider to draw down dollars, those children needed to attend at least 1 day for them to draw down dollars. And I had Bonnie do some numbers. I'm going to look to you because I didn't print that out. So pull that email for me, just so that you're ready for that question. So going back just a little bit, there were the 24 organizations, 28 summer camps that were actually funded, and then again, those 5 enrichment providers. As you can see there on that slide, the 5 were funded to provide services throughout our county. They did not have to only focus on summer camps. They could go to other providers in the community to be able to provide that enrichment service throughout the community. The next slide shows you who our providers are, just in case you needed a reminder. Who did we fund? These are the ones that we funded, the 24 throughout our community, ranging from smaller organizations such as 18 Consulting to our larger, well-known camps and organizations such as YMCA as well as Florida Girls Club. All of our contracts have performance measures. And with summer, we looked at things such as, did they enroll the number of children that they expected to enroll, the number of days, how well was the program offered, and we measured that by looking at the attendance as well as site monitoring. Our contract managers do conduct site monitoring where they go on the camp, they observe the camps through the different activities, they check the ratios, they check the background screening, they ensure that the children that have scholarships or CTEC dollars actually qualify based on the criteria set forth. And then we get feedback from the children participating in the camp as well as their parents. And we have given you guys all of that information, and I'm sure it's information overload. I want to go into
Chrissy, do you want questions as we go along, or do you want to just be helpful?
Yeah. Well, you all tell me.
Whatever's easiest for you. We can do either way.
Let me get through it then. It's not long at all. The next slide gives you an idea of the type of incentives that the programs will qualify for. We look at extended hours of operation. If your camp started at 8 a.m. and the parent had until 5 or 5:30 to pick up that child, that is what we were looking for. Those are the camps that we wanted to incentivize. We encourage our camps to offer some sort of family engagement activity, extended summer duration. That were the camps that when school let out the following week, that camp started and that camp extended through the final day of summer before school started back. And then high participation rates. So based on those, and you'll see in a few minutes, there were about $88,000 of incentive dollars that were awarded to camps throughout our county. For our new fiscal year 23, so right this moment, the contract managers as well as Bonnie and Demetrica are working with all 24 camps as well as those enrichment providers to get their contracts updated and signed. All of the enrichment providers in the camp were given an opportunity to look at the amount of the award that they were provided and reallocate based on the number of weeks, based on their sites, based on the number of children that they were going to be working on. So we sent them the documentation that they needed to be able to take that amount and reallocate it. Based on based on what they needed to do, based on changes. Some of them had to reference or consider feedback they received from their contract managers. If we had concerns about location, they needed to address that. If we had concerns about staff and background checks and training and that sort of thing, they are addressing those issues. Contract negotiations started for this week. And we'll go through this week and a little bit of next week as well, but we're working closely with them to walk through the programs that they are implementing. Trainings, every summer we offer the CPR and first aid training to all of our camps at no cost to them. This year we are extending that, or would like to extend that. You'll see that in my rollover recommendation to all of our providers. They all work with children. We figure this is something that we can extend to all of our providers. Data collection. Bonnie does the data collection training every year, so we will continue to offer that to ensure that the providers are aware of the information that we are requesting. Of course, background screening. Background screening, that's easier said than done, going through the DCF process. We've worked with Cheryl, we've worked with Diane Harris, and so we're able to pick up the phone and call them when any of our providers have any challenges. But we have a recording of that training and we're able to assist them as they're walking through that process. And then again, professional development and incentives will also be included in fiscal year 23. This slide, you guys actually have an updated version of this slide. In your packets, we wanted to provide you with an additional breakdown of information. And what this slide does is it provides a detail of what I have a number there that's incorrect, it's not much. But what the camps were awarded, what the enrichment providers were awarded, and that is that total, that 1.9 to 2 million I spoke about earlier. And then what was left on the table, if you will. For camp enrichment providers, that 88,000 is the total that was paid to camps for incentives, and then what the true rollover amount is for summer camps and enrichment only. That is what that amount is for, that $471,000. And then the last slide is the rollover recommendation, that $471,000. That's what we're focusing on. So from that pot of money, we are interested in providing that additional $50,000 to Freedom School. We are interested in using those dollars to support the professional development of our providers, whether that's summer, after school, and those training recommendations would be building positive relationships, working with special needs children, abuse prevention, suggestions that we have heard back from the board, suggestions that we've heard back from providers. If I could send my staff to these types of trainings, or if we found a way to be able to bring this topic to our area, those are the types of training that we would like to, with our partnership, identify speakers to come and present to all of our providers. And again, CPR and first aid. That will not take up all $400,000, but it is the start with where we would like to begin making recommendations for rollover. So. Thank you. Questions? Any questions?
I have a couple questions. First one, in the consent agenda, Christie and just so everybody knows, Christie knows this is coming. There was a question that gave us a breakdown per goal, what the unspent dollars will be. And I think it was confirmed earlier that it looks like, you know, that is just for someone. I don't know whether the unspent dollars by goal, by include all program, someone, whatever, but it looks like the amount of unspent dollars is about $1 million. I know that the recommendation is to take that 400 and something else. With the unspent dollars, are we just going to hold it until we go through the strategic plan and see where those dollars might be allocated later?
I'm going to defer.
Is that kind of what we're doing?
Not necessarily. I think right now we wanted to provide you with the update on summer. If it is your pleasure, we can come back and give you a recommendation for the other.
Well, that would be perhaps mine after the strategic plan. So we can see what, but that's one number.
Well, and I think that was part of our discussion. You know, could we, how much time is involved, staff time, in we knew we wanted to do these kinds of things that they've heard from the service providers we know we need to do. So being able to take the money that 400,000, use however much of it we can on these things would be great for now. And then after we complete the listening project, we would then be able to adjust our dollar amounts for the other goals
And it looks like
and programs.
cursory math that we can incorporate with what's left over, all the programs plus the previous grant. And it would be kind of, I think that that's going to be really so not much, but that was the easy question, the more difficult. And I think we did give you some direction. I don't know how clear it was about going and funding the programs,
Right.
those programs. So, Christy, when we discussed performance measures, we had a discussion about maybe upping the number of days to 2. And I don't know where we got in that discussion, but then it morphed into a conversation about talking with providers about potentially whether it's just 5 days or whether they might want to offer it, you know, have a separate one for maybe children who can't come 5 days, or a 3-day program and a 2-day program. And knowing that they have to base personnel on who's going to be there for 1 day. Where did that conversation end up? Do you remember?
I don't remember. However, what we know is that the providers are opposed to increasing the number of days that a child would attend the camp. Solely because just because a child doesn't attend the camp does not mean their program is. And what we do know from the data is that even though they could draw down dollars, even if that child attends 1 day, the average is 3.7 days. So the children are attending almost 4 days of that 5-day camp. That's already, you know, taking place, even with, and the camps do not, they don't go to camp saying, you know, you really only have to come 1 day. The goal is to have those children attending all 5 days, outside of any extracurricular activities. That's the feedback that we're getting from providers. And even with us having this 1 day, kind of this low mark, they are attending 3.7 days.
Okay. That's all well and good. Hopefully we will engage in conversation. The problem that if there's a child that's consistently coming only not very many days, we're depriving potentially another child that could be there.
Actually, we aren't, because what the providers are doing is they're going back to that family saying, this slot is available for someone to attend 5 days a week. Your child is currently only attending 1 day a week. We either need you to make sure your child is attending, or we will have to drop. This is just our internal,
If you're actually doing.
That's all right there.
Yeah.
That solves it.
that solves the problem. The contract managers, that is solely based on them drawing down dollars. The families don't know that a provider can draw down dollars only if my child attends one day. And the providers don't want that. Because then we show up and say, your numbers are low. You don't, these children are not coming, which is how Bonnie was able to pull that number for me, because we're monitoring that at the same time. So the providers are looking at that, talking to the families, ensuring that those children are attending.
I think the balance for me is there's a cost, there's a fixed cost
Yes, it is.
to having the staff in the camp. So rather than saying, if you've got a kid that comes once a week, they have to be able to draw down, because they have to say, if I have 50 enrolled kids, this is the cost, I gotta be able to draw that down. I think the opportunity is an incentive for those camps that do a lot of engagement and that their attendance rate is minimum, on average higher. So if they get to an average attendance of 4 days a week, they should be incentivized, because clearly they're engaging their families. I think that may be a more kind of, in my mind, an approach that deals with both of those issues.
I personally just think that it should be a higher number. I'll vote for it, when it comes to.
Again, that's a fixed cost.
I totally understand, but if a child is only coming one day a week, and I hear what Chris is saying, but those dollars, not the child, but the dollars can go somewhere else.
So I think that's where the average engagement is. The average attendance is 4 days a week, and you've got the bulk of the kids are coming certainly more than 1 day.
Right.
There's the drawdown of money versus the incentive and the quality overall.
What's the incentive? Chris, I don't recall, and I didn't pull this back up. When do they give the attendance incentive? Is that at 4 days or is it at 2 days?
4 days.
Okay, I can live with that.
That's really good. It's a lot better last year.
I want to give Bonnie an opportunity.
In order to kind of improve, because this summer, parents in, on the enrollment form now indicate what they expect their child to attend. So it's established up front, and we'll collect data on how much the parents expect to attend. Also informs the provider that they can fill in the spot. So to get better, match between what the parent wants and needs for their child and then what that child actually attends as a fully funded provider. So we have a better alignment between the performance measure and what they sign up for, and to set expectation that there is, an attendance. We want them to plan for their attendance, so the provider can fully leverage the dollars and serve many children for based on what their needs are. So that was the improvement that we're making to the enrollment form, so that's upfront established, and that's how we're going to be dedicating to the performance measure this year compared to last year.
Well, it would be interesting to know the number of children that will come this week. And how the provider, and then how the provider compensates, so that perhaps, there's some other child that's dedicated by the fact that child is only going to be 1 day a week. I just want to be the most we can money that we're spending. Thank you, Chris.
So, I probably am gonna annoy some people and you're gonna want me to be more involved with the finance thing, but I am back in the envelope math, and when I took the number of children who participated in summer camps and the amount of money we spent on summer camps. If a kid went 10 weeks to summer camp, 5 days a week, they went to 50 days of summer camp, that would cost us $40 a day, which I think is a bargain. But each child, and we don't know the difference between child number 1 and child number 2, we don't know that. If one child went 1 week, 5 days a week, went 5 days all summer, that comes out to $320 a day, which is not a good bargain. And the only reason I really, really care about that, and I'm a little angry about it, is because we are nickel and diming our Saving Smiles. We're nickel and diming Sherry Kitchens doing important counseling to children who have been abused or neglected. And for the health things, we are so stingy. But for camp, hey, if it's $320 a day, you got it. You got it. If your kid only shows up 1 day, it's okay. I don't get that.
So one of the things that the trust could do is if a response is required, the trust could determine if there's a certain percentage of these camps that they'd like to fund. The trust could determine if there is a cost per child per day that we'd like to move toward. There are different options. It's one of the reasons why we, can build relationships with other CFPs, see what they're doing. But based on the RFP that was approved, organizations could take a look at what it costs them. Because some of our camps are $50 per day per child, based on their award amount. Some of our camps that are STEM, arts, circus, they are going to be more expensive. And so I think it is the board's opportunity to discuss and determine how do we really want to move forward and fund these programs. Because I hear what you're saying, 100%, based on the award and the funding opportunity. This is
So I would say, yeah, I think you nickel and dime, and they, Child Advocacy Center hadn't had a chance to respond, they come and ask for funding. It hasn't that he given them money and nickel and dime, or did I miss that? No. Yeah.
Well, I mean, we just told Julie Motory, sorry, wrong time of year, come back.
But that's what we did to Child Advocacy.
That's what I'm saying. But we're giving 3 years funding to these camps without even knowing how they're really rewarded. We don't know how much it's costing per kid per day.
No, you do know that.
Do you guys have information that says Camp A
We have
had
that.
X number of days of attendance? Because if you have the total cost and the total number of days attended, you've got a cost per day for each of those camps.
Bonnie provided a very extensive summer camp overview to the board.
And it had those costs per day based on actual attendance.
And I think, Dr. Hart, like for you, your frustration, I hear from other providers who were excluded from the RFP for the summer and after school, because we've had so few proposals to go out for agencies to respond to. And so it's kind of like folks have come and we said, oh, that's out of cycle, our budget is done. Oh, that's out of cycle. We as an organization got out of cycle with the change in our, so to speak, got out of cycle and didn't have opportunities to come forward when we didn't have an ED. We didn't give direction as a board. We give direction to staff to proceed with that, in that flux right now. And he kept saying that we need to do our strategic planning and all. So this is the frustration we've kind of been going through, it seems, from the inception of the trust. But I want to like clear the air on that to say we have not nickel and dime Child Advocacy and Smiles. They're in this document that's coming up here to be funded, and I was elated to read that we're going to be doing something. I'm going to push back and say, I'm hoping you guys is not charging us an administrative fee on Smiles, that 18% or whatever it is they put on all the grants to do that. I'm willing to fund them, but I just don't think we should have to pay that as an organization. That's just,
We're getting ahead of this. I'm going to bring it in. And you have a request to approve those services that are on the slide. Because I just want to make sure what we're asking for. Yeah, so what you're asking is to use the rollover dollars you've identified for those priority recommendations for the rollover funds. Is that what you're asking? And so where we are, that is Judge Ferrero and then Commissioner Cornell.
Thank you, Christine. Under the professional development trainings for all providers, where it says abuse prevention, is that to train the staff how to identify a child who may be being abused in their home, or is that to help them learn good skills so they're not abusing children?
So that was a recommendation from Dr. Hart to work directly with CAC, as they have specialized in working directly with youth development providers on identifying child abuse, knowing exactly what to do when that has been discovered. And then CAC also has an enrichment provider where on the flip side of that, they work with the children about safe touch and so that abuse prevention is to work directly with CAC.
Not just safe touch, but like eating at home.
Right.
Those kind of things, like lots of things.
Yes.
There's one of the things that just as a comment, I think it's important stuff. one of the things that I see is that children, we send children, we ask them to go to camp or to go to school or go to daycare so that someone can lay eyes on them. You make sure they're not staying home and taking care of 5 siblings and not staying, or not being the caretaker, or not just being having problems in their home, and having another adult have contact with them. So I do see a very, very much a value for children getting out of their home
Yes.
into the public so that people can see them. Thank you.
Thank you, Madam Chair. So Christie, we have 471,000 to go over event. How much is the Freedom School allocation that you're asking for?
50,000.
50, and then some professional development?
There has not been an amount allocated specifically for what professional development will cost the trust.
Okay, what about-
We're working with our partners to determine if there will be fees. There may be, for example, the Florida After School Network that simply provides this. If we become a member of the Florida After School Network, they could potentially provide professional development for all of our partners. If that's what we do.
And then the summer trainings?
Summer trainings, CPR, I think we may have spent $3,000 or $4,000 for them to cover the cost of summer, and so that may increase a little when we include all of our providers.
So are you asking for basically 471, even though you just identified only about?
No, I'm asking that you authorize the staff to be able to use those dollars within that amount to cover the cost of the things, that we're asking for. I'm not
I think
asking,
we're gonna have a lot more available. I guess.
yeah, we are. We
Okay,
are.
so you're not asking for you to use all 471?
No.
Okay, so I mean, I think if you said up to 100,000 of the 471,000, would that cover it? And with the remainder going into like what Commissioner Ferguson was talking about?
We haven't done any of this yet.
Well, let me, let's say, so that, okay, so I'm okay with that. I'm gonna have to leave it, I'm gonna let y'all do that. Then on the 300 for the next item, is that coming out of the 471 as well, or is that coming out of the remainder of the million that you brought up earlier?
And that budget.
So, I'm sorry. We get to decide. That is the honest question.
Okay, that's fine. Yeah, I'm in favor of both, so
Okay.
I'm okay with, I like the 300 that we have. I don't wanna just say 471 and staff discussion. I want you to bring back some recommendations, because there may be some of those programs in the summer that really, really were great, that you say, hey, we want to add a little bit here or a little bit there, and I want to give you that flexibility, but that's a later discussion.
Right, yeah.
Okay.
And go ahead, because before Ken was, and I know he's got to leave here, like 10 minutes ago.
So I was saying, initially we had said that the providers would have the opportunity to come back after they evaluate their budget to possibly increase because of increase in costs of them providing business. So I think 100 here, 100 may not be enough. I don't know, because I don't know what they.
What you just said.
Right, so the question becomes.
That's what I was afraid of, member.
No.
Certain is that I didn't want to take all that 471 because I wanted to have that discussion, but it sounds like they only need 50 plus a little bit more.
So if I heard Christie, the role, part of the discussion you're having with providers now is reallocating money to their budget, which could include a request for some of this rollover.
They could not. They are within the $400,000. We need a small portion of that for the things I have asked for on the slide.
But if they didn't use all of their allocated funds, they could adjust their own budgets up to the same amount that they were awarded the year prior as part of the renewal. Is that correct?
They are able to work.
So this rollover is only one time.
Yes.
So it's really good.
Yes.
I'm a little bit confused because what you just said with Christie and you two just said, that does not include the provision that as a provider.
So they had so the reason we got all this rollover money is because they didn't use all their money. And so so their renewal contract is not lessened because they drew down less. So when they needed to adjust for inflation, they could use the money up to their prior level to do whatever their increase in costs came from, whether that's staff or other things.
Okay.
And
That's how I understood it.
also part of it is a guarantee June, that you've got this money assured for 3 years, that you've got some amount, but you know.
Sure, and then, yeah,
And then during the budget process.
need to reevaluate. So,
That's part need to leave, that's a portion.
all right, you support it. So just, does somebody want to make a motion on that recommendation?
You talked about the award.
Do we want to do these all at once? I think we need to take them separately. So the recommendation for the rollover using Ken's model, what I would need to hear is a motion up to 100,000.
I move that we allow staff to move, max up to $100,000 of the, reward amount for the items that are in the packet.
I have a motion and a second. Is any other board discussion? Do we have any public comment on that motion? Seeing none, all in favor, signify by saying aye. 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 Any opposed? Thank you. Karen, I didn't come back to you. I am so sorry. Are you sure you're okay?
It relates to different.
Okay. All right. Now, moving on to this next group are the 3 program proposals. And I'm going to have 3 questions on all of them that are sort of process questions, Christy. So I'm going to give them to you now so that maybe if you can address them as you present each, that would be helpful. It is, so we're recommending 3 specific providers for services, and I want to understand whether or not and how these are sole source, why it's appropriate for those to be sole source.
Merry Christmas.
And the fund, where the money is coming from was a question that you said we get to choose based on whether we use part of this money or part of the million, so that may be moved. And then the other is, have we looked at community capacity to provide these same services? And how has that been exhausted, including alternate payers, such as Medicaid or insurance for each of these services, so that the trust funds are being used as efficiently as possible. So I was going to ask those about all 3, so you have that information and you want to include it as you go through the executive track. If not, then you can come back to it.
So I would like to address the question and or concern about sort of the research that has gone into funding these programs. What it reminds me of or put me in the mindset of is implementation times. And that is not what we're doing or what we wasn't what we were necessarily asked to do of the board, or how the staff interpreted the request from the board. The request from the board was investigate, learn a little bit more about these projects, how funding could be used. I think we will have some of your questions answered. But did we really delve into the payer of source other than the trust? That wasn't necessarily the request to the staff. However, we have, done our due diligence to get with the program, try to learn a little bit about their resources, how their funding is being used. And so maybe at the end of the project, between myself as well as those that are working directly with them, we'll have some of those things.
And let me just say that my concern is not that I don't think all of these organizations are incredibly good organizations that are worthy of funding. I just know that there are, in some cases, at least in one that I know, there are other providers in the community that provide the same service or similar service, and yet they haven't been considered, and there hasn't been an RFP process that would allow them to apply for those funds. And I don't want us to be in a situation where if you come, you get funding. If you don't come, you don't. So it's just a concern I have overall, and it's a process concern for me about how we go about deciding an area is of strategic importance and how we go about funding it. Again, it's not specific because, like I said, I know these organizations and I have nothing but respect for them all. But I also know that there are other organizations, at least in one area, and I don't know about dental, but dental is not something I know about. that could provide, that do provide the services. And I want to make sure that if we put out funding, that there's an equal opportunity for folks to.
So I kind of agree with what Chrissy said. We didn't give her that charge because we said, when we may have the meeting in here, it was, but I really know.
It is also the response that Ken said last time, you're jumping out of your skin because we do these. We hear something and then we respond and it's not been a process. So it's bad meat and you're right, I'm one vote and
I mean, I've had that same thing with the 3 programs we bought over.
yeah, that was a whole other
thing, a whole other one, but I think when you're here, I think Maggie, and where we have been with several of our funding decisions because of that off cycle and not, we have a bank account with a lot of money and
I know,
there are all these needs in this community.
I know.
And we're waiting on a process, but I think that it's as you just said. So go ahead, Christy, I'm sorry. Go back and no, we can only talk like this in a public.
because that's the only part we can do it.
And the alternative here.
You what?
You said us going to Medicaid and all that stuff. Kids around here, we got money.
Okay, I'm gonna make one comment about Medicaid, and I want you all to remember it, so I never have to say it again. Medicaid is set up so that we don't use it. The state creates incentives for us. Now look at these people nodding. The state creates incentives that make it so difficult to access Medicaid dollars that you do stuff like create a children's trust. Just saying. It's an option, but it's really not. So. The purpose of I don't know anymore.
I'll make a couple of comments and you will now start to hear probably some very detailed questions and requests from the staff. Mainly just to ensure we are doing what you guys absolutely want us to do.
Assume I'm sure of that, but okay.
The staff left here in June, July, and August thinking that it was our jobs to go figure out how to make this funding work, what we would get for our dollars for 1 year, and bring it back to you to consider. It has been brought back before, not in the detail that I am going to go into today. It has been brought back with comments such as these will be funded in the year's future. And so in order for us to learn as much as we have for these programs, it required of us to have different introductory meetings. We've gone to different sites. We've asked them to submit what a scope of work would look like for them, a budget, and what that entails. And so this is the information that we have collected from these 3 organizations to be able to provide this information for you. So I'll start with the Saving Smile program. As you guys are aware, it is an oral health promotion program, and the goal of it is to tackle preventive dental disease in Alachua County's most needy children from ages 1 to 17. These are children from families who face economic and practical barriers accessing dental care in our county. Through this program, they offer dental exams, oral hygiene instruction, cleaning, dental sealants, as well as fluoride. And they will also offer fillings and extractions for those children who have severe dental decay. The program, I believe, as you guys are aware, uses portable dental equipment to provide dental care at different sites. That is how they are able to eliminate the issues such as transportation. They're able to go to where these families are. specifically our rural areas, which for the CPAC team was very important to us. There's a lot of data that we've heard over the course of 6-7 months through the community, members that have come and conducted public comment, as well as through the organization itself. And I'm just going to mention 2 of them. Through our Alachua County Public Schools in 2021, an average of 40% of the 3rd graders have untreated tooth decay. And then in 2020, through the Alachua County Community Needs Assessment, the greatest reported barrier to dental care was the cost of it, lack of dental insurance, long wait times for appointments. And though we have providers that accept private insurance as well as Medicaid, the wait is extremely long. And if you're already in pain, then that becomes a significant issue. And then transportation. This program we have asked them, we have looked at their long list. Where do you go? And then we added to them. Because as Dr. Attorney Swain mentioned once, our funding should be used to expand programs that have significantly exceeded the resources that that organization has, or to create new and innovative ideas. And so when Dr. Olga approached us, that was, one of the things she approached us about was expanding. We can reach an additional amount of children by hiring this additional staff. And so we're talking early learning centers, we're talking parks and breaks, and we're talking our additional rural areas. Saving Smiles really is addressing the issue that has been identified through the needs assessment in our community, which is why we are asking to fund them at $100,000. All of our contracts will have performance measures. I have provided the performance measures for each of the programs that we're going to discuss today. And so, for example, with Saving Smiles, you will see that we'll be able to track the number of children that have received services. And I'll just highlight just a couple of those. We intend for them to make sure they're providing services in at least 65% of our zip codes, which we are hoping it ensures that our rural areas do not get missed. And of course, we'll ask for feedback from those that are providing or participating in the service. Would you all like me to stop after each program?
Does the board want to vote them all together or separately?
Let's vote it.
Do you want to vote them individually, or do you want to vote them separately, all at once and do that? All right, so, yeah.
This will apply to all 3 programs. And of course, it's about money. It says from October 1st to September 30th. Obviously, that's not going to be the case. So are we going to fund it for a year, or are we going to prorate it for a budget year?
Great question. I have revised my slides. I have revised my slides to include and maybe I should revise it based on the last conversation, to include you all giving us the authority to work with the organizations individually on whether this program is established and we can fund them retroactively. So therefore it is our fiscal year, or whether it can cross fiscal years, but still only be that one award amount, because really we're talking January through the end of September if we start now. And I don't think it's fair for us to do that. And it's not fair for us to expect them to start a program that has not been approved yet.
So the only problem I see, Chrissy, is that they've already started with money that they didn't have. So, and it was to increase the number of people. So how can they do it without money that's there? So it kind of goes back to, or, if they have to get people in place, then that's going to take even longer. And so we probably talk about February. And so do we want to do it? Do we want to give them into the next budget, say, here it is, and spend it till,
I think because we've been talking about this for a while, many of them are at this point waiting for us. They may, have things in place to get this started quickly. I would love to see us The term would be January through the end of this fiscal year, and the remaining dollars roll over to the next fiscal year. I'm saying this without giving the COLA plans. Because we really want to see a full year's worth of data to come back and just show you all that we have 12 months of information.
So I think we need to understand that part of the money would come out of this fiscal year budget and part of the money would come out of next fiscal
It
year.
would all come out of this year, but it would be a rollover.
It would be rolling over to the next. Mr.
So just an example of something for some of the committees that I'm on, that we have state dollars, like Stephen's example, when we have money that comes in, sometimes we don't get it. We got the award, but we don't get it for 6-7 months. And so then we start, and then we get to sort of push past another 6 or 7 months, like an extension. And that's what I see happening here. You want us to approve it for these dates, but clearly they're not starting on October 1st. Maybe they don't start for February 1st. So all over part of it, but still this amount would be for a 12-month period.
Yes.
Yeah.
I'm fine with it.
Yeah, that's what I think. All right, so I think, Dr. Hart suggested we take them one at a time, so I'd love a motion that,
Move to the year savings smiles for, what is it, $100,000 for a 1-year period of time.
so we have a motion, a second, do we have any other board discussion?
Do we designate it? That's January 1st through December 31st, and we don't designate just one calendar,
Yeah.
1 year,
1 year.
365 days.
I would say 1 year because I'm not sure about the start date effectively for them is gonna be in terms of having to hire. But I think that's set a start date, but negotiate a start date and then it's 36.
The term would be January.
Okay.
It would be January and then 12 months out. It wouldn't be based on when they can hire. and that sort of thing.
All right, so January forward. All right, so we have motion second. Do we have any public comment? Any none, all in favor?
Wait.
Oh, sorry. Oh, we do have somebody. Sorry. Thank you. I didn't see.
I'm Dr. Olga, with Paula Dentistry Savings Smile. I just want to take the opportunity to thank you all for considering funding our program. And it's just great to see that you all are prioritizing children's oral health because it has such an impact on their overall health, their well-being, their school performance. I know there was a comment or a question of perhaps similar programs, and yes, there's several dental clinics in our community that accept Medicaid. They have incredibly long waiting times, as Christy mentioned. There's usually still a cost. They're typically farther away from the target populations that we're trying to reach, East Gainesville, rural communities, where we have a presence due to the portability of our equipment. And we also have a focus on preventing dental disease, which is much more cost effective than treating disease. And we have the capabilities to treat very young children who many dental providers lack the confidence or willingness to do so. Just last week, I was out at Eastwood Meadows in one of our programs. I saw a little 3-year-old boy with an abscessed tooth that he had been in pain. We were able to get that taken care of that day. And, he was a little bit sad, but he left in really good spirits. And his mom was so grateful for the accessibility of that service. I do want to say this funding would not go to any indirect costs with our university. So I want to reassure you of that. It would go towards the staffing of the dental auxiliary who helped to make this program possible. This is not a one-person job. We need the persons that provide the recall, the hygiene care, the coordination, the scheduling, and that is what this will go towards, the staffing of the dental auxiliary. The Medicaid from reimbursement is unfortunately so low in our state that it covers maybe the cost of the supply, for our programs. So I just wanted to thank you again. We've been having such great success in our programs. In our previous Savings Smiles last month in November, I saw a 17-year-old boy who we've been seeing for the past few months. He had 8 cavities that needed to be filled. We were able to get that all done in his final visit with us last month. And I was talking with him about finances because, when you're a teenager, you kind of start to appreciate that. And I said, if you had to go get this done at a dental office, this probably would have cost your parent over $2,000. And now he's on, routine care, getting cleanings and things like that. So we're definitely getting some growth in our program, beginning to see children for routine care and cleanings after they've received the treatment for the unmet dental needs that they presented with initially. So I just wanted to thank you again, and I appreciate you all and the work that you do for our county and our community. Thank you.
Thank you. It's all right. You're almost ready to say this. Any opposed? All right, thank you. And that did address my question about when you have that long a delay to get in, clearly there isn't sufficient capacity, and those are the kinds of programs that I'm happy to help us fund. All right, the next
organization is Catholic Charities Weekend Hunger Backpack Program. This is a program that was created to address food insecurity issues for children enrolled in Alachua County public schools. Because teachers and other school personnel are some of the first to recognize signs of food insecurity, Catholic Charities has agreements with elementary and middle school schools that allow school personnel to identify those children in need of additional food. Once a child is identified as a potential program participant, parental permission is sent home for that family to participate in the Weekend Hunger Backpack Program, and that is administered throughout the entire school year. The backpacks that the children are receiving are filled weekly by staff and volunteers at Catholic Charities. They're filled with shelf-stable food and then delivered to the participating school, who then sends it home with the child. This is, again, weekend food, and the students return the bags on Monday, and that is the pattern that happens. Then Friday, it goes home, comes back on Monday, return back to the school. In those bags, enough food is packed so that children can provide food for themselves as well as their siblings. Extra food is included for longer weekends, holidays, breaks such as spring break. And they are items that the children can feed themselves and or their siblings. For example, someone just used recognition of sometimes older siblings taking care of their younger siblings. Catholic Charities came to John Barley, who has now retired, and Denise is the executive director now. But they came to the trust because they were unable to fund this program any longer. It's a 36-week program based on the number of weeks children are in school, and they are averaging, I think weeks, document said 750 children, but we're working with them. But that is the number of children that they anticipate needing additional food in the 18 schools, elementary and middle school, that they are working with. If this program is funded during that time, Bonnie will be able to collect information from the families regarding usage, regarding their whether they thought the food was appropriate, and and I am going to let you speak if you want to about the performance measures. But that is what we'll be able to look at. If the meals were actually provided to the families, that Catholic Charities reached the schools that they intended to reach. The income level of the families, to have an idea of the families that we are helping, and the percent of families that were satisfied with this funding opportunity.
Any questions? Judge Ferreira. Everyone.
Dr. Barter. I'm supportive of this program. I think it's a really great program. I'm familiar with it, but I do have a question about the numbers. I don't do even rudimentary math, but these numbers don't seem to match. It says 8,857 and 22,753.
Oh, yeah, the slide is updated. That was the draft, and I realized that I did a number. You are correct. I called it myself. And what here's the other? The other would be, and it might be administrative things to cover the cost of the program. The 22 would be the bags and the actual food. The 18,000 would cover like the transportation of food for fuel for the vehicle that they're transporting the bags to. It would be insurance costs. So there's some admin costs because we allow admin when we are funding programs. So that is what it would be.
Insurance is an operating cost, it's not a. You can't operate an operating.
Well, what, do they have a list of what they put in the backpack? Like a, what?
They do. We did require that. I don't have that in front of me, but that is a question. When we meet with them, we ask what's in the backpack, you know, what type of information. Soups, ravioli, pudding, sorry, I can't read your hand right from over.
Okay, so we try to have a bag filled with different items that the children will have across the board nutritional. So we do fill it with veggies, raviolis, and the soups will be both, not just the can of soup, like the chicken noodles. It also includes ramen, applesauce, granola bars, and cheeses. We try to have a option for the children, and so we'll mix it in with what we add in the bags. Excuse me.
I have a question. When the food is sent home, is there any additional information for the parents? For example, how to do more nutrition, you know, more nutrition.
Nutritional facts or how to better. Yes, we have not had that. That is something that we have discussed, including in there. We've actually another program within our agency is partnering with a medical service, and so we're wanting to add that over to the Weekend Hunger Backpack and adding more options for the children, or at least teach them nutritional value with the food.
I think that would be a great, you know, additional component, you know, the couponing, have that component, stretching meals and nutrition, as you send it, you know, what the concept is giving a person a fish and teaching a person how to fish. I think all of that should go hand in hand.
Unfortunately, I mean, with that is we do service the majority of the children that we service are the elementary children. And so a lot of that information is not really transmitted to them. It would be for the parents mostly.
Dr. Hardy. Just one thing, like, do these backpacks say Children's Trust on them?
They do not
get a T-shirt that says Children's Trust. Do the parents know that Children's Trust is going to be paying for this food? Because we need the community to know that our tax dollars are going for this program.
Sure, I can answer that. So we have any program that we're funding, we do include like our logo. There's some information that has, because their consents have to be updated in order for a parent to consent to the program. So there's information that the trust is funding the program. And of course, our communication team is always working on different ways for us to add our information into someone's bag or box or that sort of thing.
Just saying.
Yes, and absolutely. We have those items, whether it's pencils and cups and brochures and shirts and bags and you name it, hand sanitizer, in order for us to drop those things in the item.
I mean, I just like Catholic Charities to say they wouldn't object to our putting our logo on that backpack.
But now what you gotta consider too is if you don't continue to fund us, then we will have to repurchase those. After the funding ends. No, I understand, yes. No, I understand the question.
Yes, excellent point. Dr. Schneider.
To pick up on what Dr. Goldsmith said, I think, as far as I'm aware, and I can only comment up to preschool, but there are explicit parts of the curriculum in preschool as part of the Florida Early Learning Standards about making healthy food choices. And I suspect, Shane, that that's probably also part of the curriculum in the elementary and middle schools, or at least elementary. So I think
being able to supplement information in there for parents about healthy food choices as well would be a really win-win situation for everybody. And that information is easily obtainable because we all know a variety of things.
Agreed. Yes, I want a motion.
We approve of the $50,000 allocation for a 1 year period of time, cafeterias for specifically for the weekend on the back end.
There you go. And a motion in a second. Do you have any other board discussion?
And I have one question. Will we do the same time period as we did with the previous one? It'd be 1 year?
One comment,
Yeah.
it's backpacks, we can, you know, you put things on backpacks, like your hand sanitizer, your water bottle, everything else, I'm sure we can find something we can clip on there that says trust.
There you go.
Not have to repurchase backpacks.
Excellent. All right, thank you. All right, do we have any public comments on this motion? Seeing none, all in favor, signify by saying aye. Aye. And aye, any opposed? All right, moving on. One more.
And just to FYI, the Savings Now program, they're actually adding our logo to several of the items, the materials that we're covering the cost of. So we're thinking along those lines.
Okay, I will tell you that the state of Florida, the Department of Children and Families, as part of anybody's contract where they fund, require on any brochures or publication that program helps fund, that it indicates that it is partially funded by and with the logo. So it's not a bad part of the contract to have it. We will always on all of them.
Okay, so Christy, you heard that?
Yeah,
It should go in the contract.
It is in our contract.
All right.
Yep, it's there. Okay, so the last program is with the Child Advocacy Center. It is the Reducing Trauma to Abused Children program. This is a program that provides therapy services to child victims of physical and sexual and emotional abuse, exposure to community and or domestic violence, human trafficking, severe forms of neglect and or abuse exposure. Children as young as 2.5 years of age to 18 years old who have been confirmed to have experienced abuse and violence are eligible for services in the program. The therapy provided is specialized and tailored to meet the individual needs of these children. Therapy typically is provided for 4 to 6 months and yield a decrease in symptoms such as bedwetting, nightmares, flashbacks, panic attacks, and many other behavioral issues. Children participating in therapy at CAC benefit from evidence-based therapy such as child-directed play therapy, parent-child interaction therapy, cognitive behavior therapy, and many more, eye movement, processing, as well as child-parent psychotherapy. They do offer other forms of therapy, such as group therapy, where children in the program may have similar types of abuse exposure, as well as psychoeducation, which is provided to assist caregivers in gaining knowledge about the effects of trauma, how to intervene when trauma symptoms arise, and how to support their children as they heal. These services provided at CAC are provided to families at no cost to them. When the executive director, Sherry Kitchens, approached the board, she approached the board about funding. Her funding request was to eliminate and or significantly reduce the number of children awaiting services. So reducing her wait list. The Child Advocacy Center model, these children are referred from what is a well-created or well-established referral system. It's a network of providers that send referrals to the center, and some of the providers consist of Meridian, Guardian Ad Litem, our public schools, all of our local law enforcement organizations, the attorney's office, DPL, DJJ, Village Counseling Center, other therapy and healthcare professionals. During her initial ask, there were 98 children on the wait list. As of today, there are about 117 children on the wait list. The Child Advocacy Center prioritized pulling those children from the wait list to receive services based on the severity of need. And children with suicidal thoughts, actively cutting, trafficked children, those who are unable to go to school or constantly running away from school due to their traumatic experiences are the children that are receiving services immediately, because those are the children exhibiting the most extreme behaviors. Children who remain on the wait list are assessed. They are provided referrals to individual therapists in our community. And they receive support to, not just the list, support to identify a practitioner to begin providing services to that child. Some families move forward with that practitioner and some choose to stay on the wait list. Families on the wait list also receive bi-weekly check-ins and regular communication with a multidisciplinary team at the Child Advocacy Center. Again, this organization too will have performance measures. We'll be able to look at the number of children pulled from the wait list. Can you pull her in case there are questions? The number of parents and caregivers participating in the therapy, the number of therapy sessions. We'll be able to collect data such as the types of income or insurance and that sort of thing, just so that we have an opportunity to come back to the board to say, here are the characteristics of the families receiving service, and that's something that we can track. CAC is solely focused on abused children. The CAC model has been successful at working with children based on their need. Services don't end until that family, that child is able to cope, or I'm sharing you probably because that's not the right word. But as children work through this, there are no restrictions based on diagnosis or funding or that sort of thing that they are considerate of as they're working with children. They're able to continue as that family is saying that they need services. The program works with, has the ability, because of the model, the national CAC model, they have the ability to work with these children from the beginning when there's an outcry through investigation, through prosecution. And so they have this model that has been successful locally. And I will stop there and entertain any questions that the board has.
Questions? We have a motion. Do we have a second?
Sorry.
We have a motion and a second. Is there any other board discussion? Any public comment?
My name is Detective Amanda Prince, and I'm a detective of the Gainesville Police Department, and this is Detective Katie Boyette. And we just wanted to come today and show the support for this CAC. We investigate crime against children. That's what we do. So that involves your child neglect, your child abuse, your child deaths, your sexual and trauma children. I have spent 9+ years in the criminal investigation division, and the majority of that time has been in the crimes against children unit. And I work on a daily basis with the CAC and the MDT. I can say without a doubt, during that 9 years, nobody provides the unique service that the CAC provides. They start with the onset of the investigation in that trauma-informed response. The crisis counseling that the children receive right after they're being interviewed about a traumatic incident is essential to the long-term care for the children. Law enforcement can only provide that short-term fix, but the CAC is truly instrumental in providing that long-term support for these families. And it's important to understand that just because something doesn't rise to the level of a criminal intervention, or it's something that doesn't meet the threshold for DCF, the CAC is still able to provide services for those families that they really don't need. We're here also on behalf of our lieutenant, who couldn't be here, but she's the commander of the Criminal Investigation Division, and has a passion for children. And she asked if we could read this on her behalf.
Good afternoon. My name is Rebecca McKenzie. I'm a lieutenant with the Gainesville Police Department and a licensed foster care parent. I wanted to take this opportunity to share with you how important the role of the Child Advocacy Center in Gainesville is to our community. I started working closely with the CAC in 2014 when I supervised the Child Sex Crime Squad in our Investigations Bureau. This role put me in direct contact with the CAC almost every day. The CAC is unique in that they not only provide counseling for child victims and witnesses of crimes, but work directly with law enforcement, the UF Child Protection Team, the Department of Children and Families, and Partnership for Strong Families to ensure that every child within our community receives the support and resources necessary to heal and address their trauma. This includes navigating the criminal justice system. Help is not limited to just the child. The support is also provided to the family and or caregivers of the children receiving services. There have been many times where a child is in need of services after hours, on the weekend, or during a holiday. Every time our agency has reached out during those times, the CAC has answered our call. They assist us in completing emergency forensic interviews, coordinating medicals, victim advocacy, and notifying other MDT members when needed. Additionally, they provide crisis counseling to the victims after forensic interviews to ensure that a child is not in crisis before they are released to a caregiver and leave the CAC to go home. This allows us to focus on our criminal investigation, knowing that the CAC will ensure that the appropriate services are provided to the child and family. Many organizations only operate during a normal work week, which makes receiving emergency services difficult at times. It is rare to come across an organization that answers the call 24/7, especially one that provides services such as counseling. The CAC is that organization. As a foster parent, several of the children placed in my care have received services from the CAC. Their model allows for quick communication across disciplines, and the relationships with child welfare organizations in our community helped children placed in my care receive services quicker. I was confident that any child I brought to the CAC would get the services needed to heal, and that they were a true partner in the child's recovery and healing process, not an organization that would just check a box. In my experience as a law enforcement officer since 2004 and as a foster parent since March of 2020, I have not come across another organization that provides the types of services, resources, and assistance needed to support victims and their families, as well as investigate child maltreatment cases. If there's one thing that can improve the CAC's response to these children and their families, it would be increasing funding to the CAC so that more children and families can receive the help that is known to improve the outcome of their cases and move them forward in their journey towards healing. Thank you for your time, Lieutenant Rebecca McKenzie. And then just on a personal note, like Detective Friends was saying, they don't just work with us on cases that end in some type of criminal prosecution. I've referred cases where I didn't reach the level of probable cause to make an arrest, but there were children that I knew needed help. And the CAC had always been there to step up and offer those services, or unfortunately in recent times add children to their wait list to await those services. And thank you.
Thank you. Any other public comment?
Hi everyone, I'm Sherry Kitchens with the Child Advocacy Center. Just a few things that I wanted to, I guess I'm not sure that I had the opportunity to mention these things before, is that the Children's Trust is not the only funder or the funder in consideration for the Child Advocacy Center. We have 7 other funding sources. The problem is that since the pandemic hit, the need has risen to such level that we need to be able to expand in order to provide the services, as the detective mentioned, exactly right away, right when they're needed. That's when we find that families and children engage in those critical services is right at that time when the crisis is passed, and they're waiting, for any period of time, whether it's our organization or another one. They don't usually get there, and a lot of times the system itself doesn't have that the authority to require the families to take their children to therapy. So when children seem like they're doing okay, they're good. That was a tough night or whatever, and they're getting better. It may be several months before the symptoms really kick in, and by that time, finding a provider becomes really, really difficult. So I wanted to make sure that the board understood that we have other funding sources that is not meeting need in the community at this time. And our families that are looking for these kinds of services in other organizations. We work a lot with the Village Counseling Center. They're probably the closest to the specific type of therapy that we provide. But They work with us on cases, but they don't necessarily do that as a natural part of their work as a working with law enforcement. I don't know very many therapists in town who can pick up the phone and call the detective on the child that they're working with on a case and give them updated information relevant to the investigation. The child may need another discussion or providing additional evidence that might be helpful in the case to keep the kids safe going forward. Sometimes when you don't have enough information at the front end of a case, it's really hard to protect kids. So that system staying together long-term for the kids really allows that safety net together. We also don't, just because a referral is made, even to an outside organization, sometimes children don't get there. And so part of the value of having the Child Advocacy Center over a counseling organization disconnected from the child protection system in this way, that we can call and say, hey, did they make it? We have an interagency agreement. They can say, need to know information. So they make it to the appointment, or did they not make it to the appointment? And then we can circle back around because we know those kids need that help and need the services and can push the system a little bit further to make sure that those kids get it. So, when she mentioned long-term, we are in for long-term for as long as these kids need us. And I appreciate the opportunity to talk to you guys. I know you did say of me coming up here. I wouldn't come up here if we didn't need any other ways.
Thank you. Any other public comment? We have a motion, second, everyone against. I think so. Yeah. I think so. Everyone in favor signify by saying aye. Any opposed? Thank you. Chrissy, is that it? All right, I do want to say, I think as a process issue, one of the things that I had the opportunity to do a little while ago is talk to David Lawrence about how to handle these requests when we have people from the community who bring us information about an urgent need or a sense of, gee, this is a little gap in the community, and particularly if they're emergent. I know Member Certain pointed out, we've been sitting on money and needing to give it out, and I think we all feel that urgency. I would encourage us to direct staff, and if I'm the only one who feels this way, then I will stop, and it is my soapbox, I think, to come up with a procedure wherein, because I think there was some I understood one thing, and it sounds like staff didn't hear it exactly the same way, which probably means I didn't communicate clearly. But I would like for us to have a policy where that kind of information comes to us. The staff then take a look at it, research it. What's the capacity in the community? What is the actual need? What are the potential funders? And then bring back to the board a recommendation for either for an RFP if there are multiple agencies that might be able to meet that need, or a single source contract if there aren't. Because then we know that there are things in this community that there are only one organization doing. But there are other things where there are multiple organizations that do that kind of work. And I think we have to have a process where we research the issue, assess the real capacity, assess the real need. It may be that the need is actually much greater than funding a couple of FTE for the CAC. And so what is the breadth of the need and how do we best address it? And I do think at some point we need to look at whether there are alternate payers, and then Medicaid's not always easy, but it is a funding source. And in some areas of mental health in particular, I will tell you that it's not a bad one. And there are at least 3 organizations that I can think of off the top of my head that bill Medicaid for those services. So I think we just need to, I want to make sure that everyone in the community that does a service has an opportunity to respond to a need. And so I think if we had a policy that said, we become aware of an issue from the public comment, this is how we respond to that issue. I think in the long run will serve us well.
I move that we nominate Maggie as committee 1 comes up with third quality.
Yeah, Madam Chair, Christy is making me aware that there was an unsolicited policy.
There is
that you all terminated that.
No, we had a policy that, no, we actually went the other way.
Okay.
We passed a policy that said we would not take unsolicited requests for funding. And that what I'm saying is, we are going to get information that there's a crisis. We've had that come up before, that there is an emergent need that we hadn't anticipated either in our strategic planning or in our budgeting. But I think the best way to do that is, okay, it's come to our attention, staff then researches the issue broadly in the community and comes back with a recommendation, whether that's a single source recommendation or an RFP recommendation. But we ought to have a consistent way of addressing the urgent needs when they are brought to us.
My motion was in jest, but it was serious.
I'm happy to work with Christy on that, but I don't want to just do that if it's only me, if that's something.
No, I do think we need a process, because I think we have had providers and folks in the community who feel left out and haven't had the opportunity, you know, as for one reason or another, you know, to bid on things. And we do know we didn't want to get into this one-off funding or whatever. So that's why we kind of went with our solicitor proposal. But we do need to have a process where, like we have this summer thing, if it hadn't been, that's what the providers were telling us, if we don't bring something back to them, the folks who are in on this one are good, but there may be other people out there, or even in the health services providers. So we got to have some kind of way.
And hopefully our strategic plan will have a focus and we'll have some RFP decisions that come from that. But I also think there are always going to be situations that, you know, like you were saying, United Way this year had to cut a substantial amount of programming. And so there are going to be urgent situations that we didn't anticipate. I just want to make sure that how we address them is equitable across providers.
Yes, motion.
Second.
Good.
Any further comment? Any public comment? This is the best way to shut me up. We have one last item on. Everyone in favor say aye. Thank you very much. Of course I did. All right. Bonnie, last but very much not least.
So the listening project update, I did my staff report in the agenda packet last week, which is available for you to review. But this evening, to give you the latest and greatest, I'm going to actually turn the mic over to Dr. Stacy Williams, who is with Prismatic Services, who is our contracted vendor. So Stacy, you still with us?
I am. I'm learning a lot and listening intently. Thank you for having me this evening. It's my pleasure to present the. Did you say could not hear me?
You want to have
Okay. Am I okay now? Is that okay?
Yeah.
Okay. I have the pleasure to provide you with an update on the listening project, and I'm going to share my screen with you, so that you can see some of the great work that's taken place as part of the Prismatic team, and also in partnership with the Trust staff. They've done a great job of supporting this project, and lots of communication between our team and the Trust team to make sure that we hear from as many folks as possible, and reaching all throughout the county. We certainly didn't want to leave any areas out, and we're not quite finished yet with our listening tour, but here's where we are. And this data is as of this morning. So you see in the circles, you may have seen this slide before, but in the circles, the top number provides you with the number of activities actually completed. So under key informants, you can see on the purple circle here, there were 17 key informants interviewed. The original goal was to have 10 plus. Also for key informants, the focus group, and that's one thing that's still, we have one scheduled actually for Friday. We invited the key informants, the partners, and the providers to be a part of a focus group. And right now we have 8 that have committed. We emailed over 150 a couple of times, reaching out saying, hey, will you please participate? The good news is, as you'll see in the data here, is that we have heard from them on interviews. If you look here in the middle, the blue, 29 have actually filled out surveys, and that's just key informants and partners. We've had 71 surveys from the providers, and then we'll do the focus group as well. We have interviewed all 9 Trust staff. I believe you received that update last month. We do have 59 parent and youth surveys from the weekend that still have to be processed. We process by zip code. We try to break it down, as far as we can, again, to make sure we're covering all areas of the county. For the surveys for parents, and that's this column here, 334 parents have completed a survey, and 32 of those were in Spanish. We've held 16 focus groups, and we do have one more virtual focus group tomorrow night. We threw out the idea of virtual focus groups. We weren't quite sure if people would like it, but the two virtual focus groups we had last week, we had a total of 28 participants. And for the focus group tomorrow night, we have had 57 people to sign up. So that tells us the word is getting out there. So we will have multiple people doing breakout rooms to do the focus groups to accommodate those tomorrow night. Also, under the youth category, we've had 255 student surveys. 17 of those were in Spanish. And part of the 59 that have not been processed are also the youth surveys. We've had 3 youth focus groups as well. And originally we had planned on 2 community meetings, but we felt like there was a need to maybe have a third. So we have had 3 community meetings. I wanted to kind of update you on some of the project pivots. While you might see that we had a certain number planned and that number changed. So looking at the parent group, looking at the focus group events, originally we had planned for 9. We'll have after tomorrow night completed 17. We felt like we needed more because we had too few participants in the initial focus groups. Again, just getting the word out. As the longer the project's gone on, the more folks know about it, and the more people who have signed up and wanted to participate. So the change made was there was that we added 8 parent focus groups. For the providers, partners, and key informants, looking at interviews, focus groups, and surveys. Originally, we planned for 10 interviews, and we actually already completed a total of 17. We had talked about doing 4 focus groups initially. We wanted 85% of surveys completed out of that group. We've had over, as of last count, we've had 100 surveys completed. So what we did was shift some of the planned focus groups into other areas, into the parents to add more there. We wanted to reach more parents because we've really given the providers, partners, and key informants lots of opportunities, including individual interviews and the focus group coming up. Some of them have already participated in community events, and then we've had a great survey participation. For students, we said 3 focus groups and then an additional 2 if needed. We've already completed 3. And we felt like we had data saturation with the youth as far as that goes with focus groups and surveys. So we shifted the possible 2 additional, again, we shifted that to the parent focus group as well. And then community, I've shared a little bit about that already. We had 2 originally planned, and we ended up holding 3. We wanted to have another opportunity for the community to participate. So that's our update for now. Do you have any questions that Bonnie or I can answer?
Questions? Thank you. Any questions? I'm not seeing any hands going up. I think people are good. That's a great update. That sounds like a lot. I have seen the full page ads in the Gainesville Sun. I said, "Oh, this is."
Yes, we also sent, we went through PHR to send all parents of the public school, they use PHR to get flyers out. So that went out to all of the parents of those schools, but we also reached out to the private schools as well to make sure they had the same opportunity to also complete surveys. And just in our different efforts, we've reached out, asked for their help to get more recruited for focus groups and surveys and community meetings as well. So we're excited about the work that's happening, and we're looking forward to another focus group tomorrow night, and then the provider focus group on Friday.
Excellent. Thank you. Thank you very much.
Thank you.
Oh, the question.
Yeah, Stacy, hi. I don't know how to look at you. Nancy on the speaker. How do you look at me? Stacy, you're super in that little corner. Yeah, I hate getting my back to you, but most of the people in the room know I'm a Rotarian, and I read the Rotary magazine, and there was a really good article in here entitled "Less Power to You." You know the expression "more power to you." Less power to you, and the subtitle is "By surrendering some control, philanthropists can do even more good." It's just a one-page article, and I was hoping if I could get staff to send it to you, you could share it with your people who are preparing a report for us, because I'm hoping the report is going to tell us stuff we don't know and we don't necessarily want to hear. And this sort of explains how you do exactly the process that we hired you to do. Thank you so much for doing that engagement. And now how we use this information to make us be a better children's trust. So it's just a one-pager, and I'll pass it to folks here, and we'll make sure to get it to you.
Okay, that's great. I'll definitely get it to everyone on our team as well.
Yeah, share it with all of us if you would. That'd be great. Thank you very much.
Thank you.
I think we have one more item on the agenda, and so I will turn it over to. Okay.
So at this time, we want to, as we close out the year, we'd like to thank a couple of our staff for a job well done.
All right, so first recognition award goes to the incomparable, hardworking, does it all for money and time and all kinds of attendance and all those things, Nicole. So don't you want to come up with one? You know, no one is high, nobody in this organization is happier to see a chief financial officer starting. I'm sure. In the meantime, she has, I mean, people do not know how much this woman has put in terms of all these reports we get that look all pretty and nice. Very cool. Thank you. And the other, I don't have to say much about her to the board because she worked with us so diligently and did so much to keep us afloat. And certainly made my life a lot easier as chair because I knew I was in good hands, and that's Christina. No need to say much longer. And did a fabulous job of negotiating, navigating this group. Oh, yeah. The community and the providers. So thank you. And that's a great way. The only other item is just an FYI, the tree compliance letter is in your packets. We don't have any discussion over that. And then the only other thing is board member comments. I'm going to start Cheryl at your end.
So just to remind everybody that's on our steering committee, we have our meeting, we have a workshop on Friday. So we will be meeting here at 9:30. All right, looking forward to that.
See you then. Just thanks to all of our CTAC staff, you know, the recognition of all the work, all of you do. We're grateful and thankful, so thank you.
Amen.
I'll be quick. I really have enjoyed our executive director's emails to the board, sort of updating the week. It's been very helpful and just nice to see and positivity. I would love to see, maybe not that exact everything, some of it's a little more personal to you, but I would like to see us have a list on our website of the things you did last week or what the staff did last week so that people know what we are doing to get out to the community. Because a lot of the information and people you're meeting with are great. It's great. I think it would be nice for everyone to know who you're meeting with so they don't really think, oh, I should do with this person. Oh, she did on these 2 days. I think that would be a nice idea. Thank you.
Y'all are simply wonderful, and I hope y'all have a tremendous holiday season, and I hope Santa is good to every one of y'all.
I'm gonna come back around this way.
Just echoing what everybody said, and thank you all for a great year and all your support, and happy holidays to everybody, including our partners who are in the room and not in the room today. So
And I guess my comment is, you know, when you start a new organization, they're forming and forming, and I feel like we're forming and not storming. And I really appreciate the presence of Marcia Kiner because she seems to be the glue that's putting this together. Thank you.
Well, I'd say, Merry Christmas to all the staff, happy holidays, enjoy your family, and thank you to the staff who've had a year. We got through it.
I want to wish all of you a very, very happy holiday season and thank you all for your amazing work. And I hope you get some R&R over the holidays with your family and friends. So thank you all. And thanks to the board for making this a great year.
Yes.